Hi, so my name is Melissa Atlas, and I am the Director of Education and Credentialing here at MHAI and the Stanley W. DeKemper Training Institute. So excited to be with you today. I'm here to talk to you a little bit about addiction and the brain. One of the more common things that comes up for clients and their families and for their caregivers is what's really happening? Is this just a behavior? What's going on when we're talking about addiction? Some people think of it as a disease or disorder. Other people are really uncomfortable with that. So I'm with you today to talk a little bit about the different regions of the brain that are at play when we're talking about substance use disorder and how this really does seem to be a disorder of the organic brain material and how it communicates with itself. So I'm going to do a little drawing on the board. My handwriting's not great, my art skills are not great, but that's not why you're here. So we'll just go ahead and get started. So we're going to pretend that this is a cross section of the brain. So this is the front, kind of behind the forehead, and this is going down the back here. And there are three main regions that we'll talk about when it comes to addiction in the brain. So the first one we'll discuss is this little nugget right here. And the fancy name for that is the amygdala. And this is the oldest region of the brain, both in the individual and in the species. I do like to break here and say that I usually talk about things from the standpoint of evolution. So if that's not comfortable for you, totally understand. We can talk about that as how God created us to grow over time. But either way, the amygdala is the most centrally located part of the brain, and its job is to govern immediate survival. So this is the part of your brain that regulates your heart rate, your blood pressure, your respiratory rate, and it is also what we will call your go system. So if you were to hear a loud noise, this is the part of your brain that would have you hitting the deck and getting on the floor before you really understand what's happening. It's all about go, it's all about response, the immediate threat. And so this is the part that is governing your immediate, imminent survival. Hopefully that's clear. We'll come back to that. The next region we'll talk about is this little area of the brain. And that's the basal ganglia. And so that's on, one on either side of your brain, and it comes in kind of like an apostrophe or a comma. And it is the part of your brain that governs pleasure. So we'll call this your woohoo system. So its job is to notice when things are good. Now, if you've never asked yourself this, why are the things that are good for human survival good for human survival? Why do the things that feel good feel good? And it's because pleasure helps us know when we need to do more of something. So chocolate, bacon, sex, all that good stuff produces a response in the woohoo system, and our amygdala notices that. It's like, oh, okay, noted. I need to be looking for this cue that this is coming as often as possible. And so that's how those two systems are supposed to interact. The last region we'll talk about is the prefrontal cortex. And this is like the last region of the brain to come online. It really doesn't develop fully until your mid-20s. And it is your stop system. So this is the part of your brain that, if you've ever wondered why teenagers do dumb things like the Tide Pod Challenge or car surfing, it's because their stop system isn't fully on board yet. This is why kids are not great at impulse control. It's because they don't have the neural capacity, they don't have the area of the brain developed enough to tell them there's a future them that they need to be watching out for. So its job is to help us survive when it comes to polite society and to regulating impulse control. So in a working system, how this is supposed to look is I go to the store and I see this amazing new TV. It's huge, it's beautiful, it's gonna look great in my living room, and it's $800. Now, my basal ganglia has learned that watching sports and Star Wars and all the other things in ultra high def, huge in my living room kinds of ways, is a pleasurable experience. I want to do more of that. So my go system starts to reach for my wallet. It starts to make the decision that this is something I want to go ahead and do. But the stop system says, hang on a second, our tax check hasn't hit just yet. We don't have the funds, rent's due tomorrow. We came to Target for milk, right? So that helps us to exercise that impulse control so that we can pay our rent and continue to do what we need to do on a larger scale. Or conversely, it might say, you know what, we did get our tax check and, playoffs are coming. I shouldn't talk about sports. I don't really know what I'm talking about there, but it's okay to go ahead and do this. Have at it. So it really helps us know when to go, when to stop, and how to pump those brakes. So if we come back to substances of abuse, anyone you can name all kind of act in a same but different kind of way on that basal ganglia. So any pleasurable experience you can think of, drugs and alcohol produce a larger than expected response in the basal ganglia. This feels not just good, but amazing. And so if that's the case, my amygdala has been taught to look for those better than expected results. I got to do this all the time. This is crucial. This is so important. If it feels this good, it has to be absolutely vital to my existence on this planet. So I'm going to do this as often as I can. And so that bonds between our basal ganglia and our amygdala around that behavior is very strongly reinforced. And depending on what's happening, my prefrontal cortex may just not have time to weigh in. This connection is stronger and quicker. Also, our amygdala doesn't use a lot of words, right? Remember when I said something about I hear a loud noise, I hit the deck? I didn't decide, gunshot or whatever. I just did it. I add the words later. So we can't really reason with the amygdala. It just reacts. Many people who have substance use issues that become problematic in later life started using in their teens. Not everybody, but generally your risks are much higher of having a major problem later in life if you started using in your teens. And that makes a lot of sense because this part of my brain wasn't developed. It wasn't supposed to be. So when I was 16 and I walked into a party and somebody put a shot in my hand and I did it and it felt amazing, I don't have the prefrontal cortex, the neural capacity to be like, ooh, I should be careful around this. I just know it was amazing. So that bond gets put into place long before I have the neural capacity to learn something different. The other thing that I want to mention here is the role of trauma in some of this. So very quickly, trauma is when something terrible happens to you. And in general, you feel like it's something that is a threat to your survival. So that means our amygdala is on deck to protect us from whatever that was. It can be a lot of different things, and that would be a separate training. So we'll talk about that later. But the amygdala is there to respond in that fight, flight, or freeze space. It's scary, it's big. I need to protect myself at all costs. So the amygdala is sort of given more free rein to worry, to be looking for cues that danger is coming because danger has come and it was bad. So we definitely don't want that to happen again. And so for many people who have a trauma history, their amygdala is actually larger in size than a non-traumatized brain. In addition to that, many people who wind up having problematic substance use have a trauma history. The rates are kind of vary depending on the study you're reading, but they're really, really high. And so my amygdala needs to calm down, and I find a substance that does that. Fused, right? So those are some really important things to understand, that you didn't decide that. You didn't decide to grow your amygdala. It's not like I can sit here or do reps or something like that to grow that in size. It just happens based on my environment. And I find something that seems to help momentarily. The other thing that I wanted to mention here, Psych 101. Come with me. All right. So there's this thing called conditioning, and there's positive reinforcers and negative reinforcers. And so when I say those words, people think negative, bad, and that's not what it means here. Positive meaning I give something, negative meaning I subtract something. So if I'm 16 years old at that party, I get the shot of tequila, I do it, and it's like, woo, best time ever, I'm amazing. And that's the end of it. I just get some positive reinforcement from that behavior. I might develop a substance issue, I might not. If I'm a different 16-year-old kid and I've got a lot of crappy stuff that's happened to me, I've got a lot of anxiety and stress, and someone hands that same drink to me, and it removes discomfort, it takes away the anxiety, it takes away the fear, it takes away the feeling of being other, then that's a negative reinforcer. It's taking that discomfort away. So I am much more likely to develop a substance use problem because that's very reinforcing. I feel normal for the first time ever. Let's do this thing. This is what gets me up to everybody else's level. I don't have a choice. I've had many clients talk to me and say things like, oh, I'm just going to drink from now on. That's the solution to all of the problems. And they don't have a problem, they have a solution. So giving that up, entering recovery, very, very challenging. It's also, when I talked about this being about survival, this is not nice and fun. It's, I have to do this, or part of my brain, this little part right here, believes it is legitimately going to die. So I'm a very blessed person. I have a lot of wonderful things going on for me. But if I was imminently about to die from something, I would probably compromise a whole bunch of values to not have that experience. I would lie, steal, cheat, no questions asked. And when it came down to it, I might say I wouldn't change my opinion of myself. I was just doing what I had to do. So I think a lot of people who are struggling with their substance use issues feel that same kind of way, where if you knew what this did for me, you wouldn't ask me to give it up. If you knew what this did for me, you wouldn't believe it, right? So it's not just I'm screwing everybody over and I'm messing up my life and hurting people's feelings because it's fun. I'm doing it because I feel like if I don't, something really, really bad is going to happen to me. When you add to that tolerance and withdrawal, so the more I use, the more I have to use to get that same effect, and if it's removed all of a sudden, then I feel really crummy. That's withdrawal. And so that's going to be the mirror opposite feeling of what normal is supposed to feel like. So I feel like I'm getting a little faster paced here. So let me break it down. Let's say I have chronic pain. I walk into my doctor gives me opioids. That doctor has now, that opioid has removed that discomfort from the chronic pain. That's a huge blessing to me. So I go through life knowing I can avoid this pain. I don't have to think about it. I might feel pain later, so I'm going to go ahead and take it now. And that's all well and good until I run out, someone steals them, I decide I don't want to take them anymore, and now I feel extra pain because that's what withdrawal does. That's super terrifying if that's the feeling I'm trying to avoid. Many people with alcohol use disorder will talk about having chronic anxiety. Many people with opioid disorder, illicit opioid disorder, are going to talk about not just physical pain, but emotional pain that the opioids really helped with. We talk about self-medication all the time. That's a very real thing that's happening. And giving that up is terrifying. So no one asks for this. This is not a decision. No one's like, you know what, sounds awesome. Let me get high and just piss everybody off. That's not how people work. It's, I have to do this in order to survive, come what may. I mentioned Psych 101. We're going to go back. So if you're watching this video, it's probably because you're either in recovery yourself or you're wanting to help people in recovery. Thank you for being here. It's really, really hard if you don't know that already. And it's really, really hard in part because of this. But let's talk about triggers for a second. So if I am walking down the road and I start to get chased by a really scary dog, my amygdala is going to kick in, I'm going to run, my heart's going to race, I'm going to sweat, all the things, and I'm going to get to safety, hopefully. And that's the end of that. Now, all the while, my amygdala was observing all of the things, noticing the sights, smells, and experiences of that little square of the street where the dog was. So The next time I happen to be down that road and I'm like, oh, wait a minute, that's where that scary dog was, right? That's my amygdala kind of feeding me that information back. It's saying, this was not good, this was scary, we might want to be on high alert for any scary dogs. So when we are talking about substance use, every time you used, your amygdala took a snapshot of that moment. So everything that you were listening to, everything that you were wearing, all the people that you were with, everything in that moment is part of, oh, the drugs and alcohol were imminent here. So this is my cue. When I smell that thing, when I hear that song, when I'm around this person, my brain is sort of expecting to get that drug. So if I see somebody that I used to rip and run with at the gas station, like, hey, what are you doing? My amygdala says, oh, maybe they got something on them. You didn't decide to have that. You didn't think about it. And it may be a very visceral, embodied experience where your stomach drops, does flips, those kinds of things. And it's because your amygdala's like, it's go time. Go system, it's go time. So that's a little bit like Pavlov's dog. Every time, and if you know it, you can skip ahead, and if you don't, just bear with me, but there was a guy named Pavlov. He had a dog. He was trying to figure out how we understand conditioned responses. So we feed the dog, we ring a bell every time. And eventually we could ring the bell and the dog would produce saliva, a physiological response to just the bell, even if the food wasn't present. When you think about it, that's kind of crazy, right? Because the bell has nothing to do with food. I'm not going to eat because of a sound, but that brain made that connection. So every time you have that expectation and you have that experience of craving, that's a conditioned response. The rest of that experiment that they don't always get to is eventually you could do something called extinguishment, where I ring the bell enough times without feeding the dog and the response of saliva goes away. Takes a while, but it happens. So every time I have a trigger and I don't use, I'm lowering that conditioned response. The problem is if I have a return to use, even a slight one, same thing with the dog. We fed the dog one time, rang the bell one time, and the dog's response, conditioned response goes right back up to where it was at the beginning. So that's why flirting around with continued use or using a substance that isn't your real problem, but my problem was opioids, and so like a beer should be okay. It's still playing with fire on the level of your brain. So it's something to really be aware of. I'm thinking that I started this off by talking about how many people are uncomfortable with the concept of addiction as a disorder or a disease. Well, what about diabetes? What about cancer? Yeah, those are all disorders that are happening on a cellular level in specific areas of your body. Just because your brain is super complicated and drives your behavior doesn't mean it's not your body. It doesn't mean that it's not organic material. And so this is bigger than just no willpower. This is bigger than I don't care about people or that I'm trying to ruin my life. This is about parts of my brain having very different ideas about how to survive, what's most important, and about having real difficulty with impulse control. So if I can accept that now that's my fight. That's where the fight is located here. Now what? If you don't have connections, to people in recovery, if you don't have supportive people, get them, right? Because as I mentioned a while back, that the amygdala is not a very verbal part of your brain, but what 12-step programming has known for a long time, what talk therapy has known for a long time, and now we have the science to back it up, using your verbal processing moves this out of the amygdala into the verbal processing center, which is down here. And now that's in a higher level part of your brain that gets you a little bit more ability to exert control. I'm really craving right now. I'm really frustrated, and I typically use when I get high or use when I get angry. Whatever that is, it takes the sting, it takes the urgency out of it. So it's not just nice, it's crucial. I'm sure there are things I'm forgetting. I'm sure that hopefully we can process this together. If you have questions, feel free to contact us. Thank you so much for watching.